tell me, what is reflux disease? What do you call it?
Well, we call it lots of terms. We call it dyspepsia, you can call it acid regurgitation, or you can call it heartburn. They all mean about the same. That is this feeling in your chest, this burning sensation. Heartburn we tend to use when it's not causing us any harm. Yes, it burns some, but it's not interfering with our lifestyle or doing what we want to do. It hasn't caused any scar tissue or complications. But when heartburn or that burning sensation affects our quality of life, the way we sleep or eat, or gives us complications like food getting stuck, we call that dysphagia, then that's a disease, and we call that GERD. Gastroesophageal reflux disease.
When we get reflux, does that cause that heartburn or that dyspepsia?
That's what that calls, yeah.
When you take a history from a patient, how do you know it's not ulcers of the stomach or the duodenum?
Well, they're similar, but not the same. A good clinician can usually find out, heartburn tends to get this acid feeling coming up, whereas ulcers tend to be more of a pain episodes. They hurt in about the same area, but they're a little bit different. Ulcers maybe worsens with food, whereas heartburn worsens a couple hours after food.
Is there a classic history for somebody that has reflux disease? I eat before I go to bed and I wake up with heartburn?
That's a classic history. That would be one of them. Or whenever I overeat, I just get this acid feeling coming up. It gets into my mouth. It tastes funny in there. That would be a classic history.
So this acid can reflux all the way up into the throat?
Yes, it can go up as high as the vocal cords when you're sleeping. There's even some reports of it hurting the mouth, the tongue, or even eroding the enamel off your teeth.
Oh, so can it cause hoarseness in the morning from the acid?
It can cause hoarseness, throat clearing, coughing. It can cause a lot of extra or outside of the esophagus symptoms.
Wow, so it's not just simply heartburn. Now, if reflux disease, which is acid coming up in the esophagus, if that goes for a long period of time untreated, what can happen?
Well, it could do two big things. It can cause scar tissue because the healing of inflammation can give scar. So people can have scar tissue. We call that a peptic stricture, or sometimes a Schatzki's ring. Or it can cause a funny type of skin called Barrett's esophagus. And that's where the stomach skin sort of grows up into the food tube to protect it. Our stomachs can tolerate acid. It's our food tubes that can't. So our stomach protects us by growing up into the food tube, and that's not it. That's not normal skin, that's abnormal skin.
The significance of that is what?
Unfortunately, that has a cancer risk, and therefore that's called Barrett's esophagus, and that's the big thing we look for people with chronic acid reflux, bad enough that they're using a lot of medicine.